Action.
Hi, my name's Tom.
Hi Tom, I'm John.
John, this is the patient assessment and management for a medical situation. The station is designed to test your ability to perform an assessment of a patient with a chief complaint of a medical nature. You are responsible for all aspects of scene management and patient care for a given scenario. You will have 10 minutes to verbally complete a simulated patient scenario. Remember that since we cannot see the patient, you must verbalize every action. I will provide assessment findings and other information only at your request. Conduct yourself as if I am the patient and ask me any questions you would normally ask a patient in this situation. I will also play the role of bystander or other healthcare providers. Verbalize all interventions, ask any questions, and verbalize any treatments you would normally provide in the field, just as if this were a real call. I will acknowledge your interventions and may ask you for additional information if needed. Throughout the scenario, you may take notes if you wish. Paper and pen are provided for this purpose. At the completion of the station, leave all notes in this room. Please remember you are not permitted to discuss any specific details of this station with anyone at any time. You have 10 minutes to complete the skill station. Do you have any questions?
No sir, I don't.
Your scenario then. You are called to the residence. It's 2:30 in the afternoon for a 54-year-old male complaining of chest pain. When you arrive, you are met at the front door by his wife and you are led into the living room where you see your patient. We'll go ahead and begin.
Okay. It's 54-year-old male, and you're at a residence. Okay. As I'm responding, I'm going to have my BSI on, my crew and I. And as far as scene being safe, we're going to be thinking, since we're going to a residence, I'm worried about things like dogs, and I'm not walking into the middle of a domestic dispute.
There are no hazards you need to be aware of.
Okay. My nature of illness is a cardiac call. So based on that alone, I know that I'm going to need to call for medics. And I'm also going to want to make sure I take oxygen equipment, vital sign equipment, maybe even AED inside with us when we go inside. One patient.
Just one patient, and your ALS is 20 minutes away. The hospital is only 10.
Okay, so I have ALS on the way. As I arrive on scene, I'm going to walk up, I'm going to knock on the door, and what happens?
Again, the wife leads you into the house, leads you to where her husband is seated in the living room.
Okay. My general impression then is a 54-year-old man. Is he awake?
He does notice you when you walk in the room. He does appear to be anxious. He is pale looking.
Okay, is he seated?
He is seated in a slightly leaning forward position.
Okay, that's my general impression right there. 54-year-old male, pale skin, seated, appears to be awake. That's my general impression. So I'm going to walk in and introduce myself. Hi, my name's John. I'm with the fire department. What's your name, sir?
He tells you his name is Bob.
Bob, how old are you?
He tells you he's 54 years old.
Okay. What seems to be the problem today, Bob?
It feels like somebody is sitting on my chest.
Okay. Has this ever happened to you before?
It had happened about a year ago, but not to this severity.
Okay. What did you go to the hospital for it a year ago when it happened?
I did go to the hospital a year ago.
What did the doctor say it was?
They said it was angina.
Okay.
And usually if I rest, it makes it feel better, but it's constant.
What happened today that this all came on?
You know, I ate lunch at noon. I was just sitting in the living room watching TV when all this came on.
Okay. I'm going to stop the scenario just for a second. Bob is obviously not injured, so I don't need to worry about cervical spinal mobilization. As far as an airway, his airway is patent. He's talking to me and such like that, so I'm happy with his airway. His breathing, he seems to be talking to me in complete sentences. However, he's having chest pain. So based on that, I'm going to have one of my partners go ahead and put him on 15 liters of oxygen with a non-rebreather mask. So we're going to go ahead and get that started. I know he has a pulse because he's talking to me, but if I would reach over and feel his pulse right now, what do I feel?
You feel a rapid, strong pulse at a rate of 110.
Okay. And when you said his skin was pale, I saw that in my general impression, but if I reach over and touch his arm now, what's his skin color and temperature?
The skin is cool and moist to the touch.
Okay. And I don't see any bleeding anywhere, is that correct?
No bleeding.
I don't expect to. Okay. I'm done with my initial assessment. My patient is a priority patient because he's having chest pain. So we need to get him going to the hospital. So I'm going to have one of my crew members go out and get a cot, and bring that in. And while they're doing that, I'm also going to have someone get a set of baseline vital signs for me. And while they're doing that, I'm going to go ahead and continue to get some information. So, Bob, besides this chest pain, how else do you feel?
I do feel a little nauseated.
Okay. Anything else?
No, just the nausea and then the pressure on my chest.
Okay. And are you allergic to anything, Bob?
I'm allergic to codeine.
Codeine? Okay. Is there anything else you're allergic to?
No.
Any plants or foods or anything like that?
Nothing like that. No.
Okay. Now, what medicines are you taking?
I take atenolol.
Okay.
I take Loped. I take aspirin a day, and I'm prescribed nitroglycerin.
Okay. Have you taken your medicines today as prescribed?
I have taken everything except for the nitroglycerin.
Okay. Do you have your nitro here with you?
I do.
Okay. And I'll have someone collect that so we can check that to make sure it's not expired and it's the appropriate medicine and such. Besides these medications, are there any over-the-counter medicines you use?
Yeah,
Or?
I take folic acid.
Okay. Anything else?
No, that's the only other thing.
Okay. No vitamin supplements or, okay.
No.
Bob, do you use any recreational drugs?
No, I do not.
Okay. Do you have any erectile dysfunction drugs?
No, I do not.
Okay. And you haven't used any of those? Okay,
No.
good.
No.
Now you have some high blood pressure, and you
Yes.
said you had that angina. What else do you see your doctor for?
For my triglycerides, or
Okay,
then cholesterol's up.
okay. What else do you see your doctor for? High blood pressure and your angina, your cholesterol, anything else?
That's pretty much it.
Okay. Nothing else you've been hospitalized for? Any surgeries?
No.
Okay. Yeah, it's right now, I mean, time of day it is. What have you had to eat so far today?
Well, at lunchtime, at noon, I had a sandwich and some soup.
Okay. And anything else?
That was all.
How about anything to drink?
I had a cup of coffee with that.
Okay. Have you had any alcohol to drink today, or?
No.
Okay. And events prior, I know. I mean, he was just sitting here, he ate lunch, and this kind of came on, on its own and such like that. So I understand his events prior. So right now we're going to go ahead and I'm going to find out what my baseline vital signs are.
The blood pressure is 126/80. Pulse is 110. Respiratory rate is 26.
Okay. We're going to go ahead and Bob, we're going to take you to the hospital. We need to get this checked out just to be safe. So you'll go along with us to do that?
Yes.
Okay. So we're going to get you on a cot and we're moving you towards the truck. As we're on the way out to the truck, I obviously know this pain came on suddenly.
Yes.
And you didn't really do anything that brought it on. I mean, is there anything that you could do that makes it better or worse?
Nothing was making it better or worse.
Nothing. Okay. And can you show me right where the pain is?
It's in the center of my chest.
Okay. Does it stay right there, or does it go anywhere else in your body?
It's going up into my left shoulder.
Okay. On a scale of 1 to 10, with 1 being no pain at all, 10 being the worst pain you've ever felt in your life, how would you rate your pain right now?
Right now it's an 8.
It's an 8? Okay. And the clock right now, what time of the day is it exactly right now?
It's 2:30 right now.
2:30 p.m. So what time did this come on?
It probably about 20-25 minutes ago.
So just about 5 after 2, 2:05 p.m. is what time this started?
Yes.
You weren't having anything before this?
No.
Okay. We're going to go ahead, we're in the ambulance, we're going to go ahead and start for the hospital. As we're starting towards the hospital, I want to go ahead and look real quick. Do I see any jugular vein distension?
No.
Okay. And when I listen to the lung sounds, what am I hearing?
They are clear and equal bilateral.
Okay. If I press on Bob's chest, does he have any chest wall pain?
No, he does not.
Okay. How about his abdomen? Does he have any abdominal distension?
No distension.
Okay. And I look at his ankles, pull his socks down and things. Does he have any swelling in his ankles?
No, he does not.
Okay. I'm going to go ahead and call the hospital, give him a report on what's going on with Bob. The fact that he hasn't taken any of his nitroglycerin, make sure his nitro is appropriate, it's the correct dose, and it belongs to him, and things.
It is his nitro. It does not expire until December of next year.
Okay. We're going to go ahead and call the hospital, give him a report on this patient. Let him know that his blood pressure is 126/80. He's not taking any of his nitro yet. He's still having pain at this moment. It's an 8 on the scale of 1 to 10. And see if we get permission to assist him with any nitroglycerin.
Medical control tells you that's affirmative, go ahead and assist up to your maximum dose per protocol.
Okay. Now what we're going to do is, Bob, again, we're on the way to the hospital. We're already during transport. I'm going to go ahead and give you this nitro. Put the nitro in my gloved hand. I'm going to take it. I'm going to pull the oxygen mask away. I'm going to drop this underneath your tongue. I don't want you to swallow it. I don't want you to chew it. I just want you to let it dissolve there on its own, okay?
Okay.
Okay. So I'm dropping it underneath there. Put the oxygen mask back on. We're going to wait 3 to 5 minutes. I'm going to go ahead now and recheck his vital signs. What do I have for vital signs?
Blood pressure is 122/78. Pulse is 100. His respiratory rate is now 24.
Okay. Okay. We're going to go ahead and assist with another nitro. Or I'm sorry, before I do that though, severity scale, 1 being nothing, 10 being the worst.
Right now, it's a 6.
It's a 6, so it's come down a couple points.
Yes.
Okay, good, good. We're going to go ahead and repeat nitro. And after we repeat that nitro, same thing, check vital signs, recheck the severity scale. We're also going to go ahead and just, we're repeating vital signs essentially with that, but I'm going to repeat my head to toe assessment, time allowing, my focus assessment, see if there's any changes in that. I'll recheck my ABCs if there's any change in his condition, but essentially at this point we're just going to go ahead and continue transport, and I'm done.
All right. Thank you very much.
Thank you, sir.
Good.
Okay. I don't know, did I forget anything? I don't know.
I didn't know if you wanted to give up to all 3 nitro, but.
Yeah, I wasn't sure either, and I don't necessarily make them go through all 3. And